Hello, Professor and class. My name is Carrie Ann Binger, and welcome to my presentation. This brief provides a comprehensive examination of Wyoming, the future health policy of a rural state. As the state of Wyoming faces challenges with a rising mental health crisis, state legislators and community leaders must take the problem head on and turn to propose policy changes that will enhance access to care for its residents. In today's presentation, I will break down why this proposed policy has been recommended given the current state of healthcare in Wyoming. I will dive into the history of mental health initiatives, how this proposed policy benefits its patients, and I will describe why I think this policy is the best choice for healthcare clinicians. Delving further, I will outline the key selling points of such a proposed policy and conclude the presentation with a summary, providing an all-encompassing review to convey how these actions create a stronger, sustainable healthcare system. Among the top issues, healthcare access is a growing concern for individuals who need behavioral health services. Wyoming's three most significant concerns are a lack of access to care, high uninsured rates, and most concerning, a lack of mental health resources. As of 2024, Wyoming has a population of approximately 587,000 people. Its three largest cities, Cheyenne, Casper, and Gillette, have a combined population of 158,000 residents. This means only 27% of the state's population lives in its three largest cities, while 73% of the population lives in small communities and rural areas. This dispersion of people creates a unique problem in terms of healthcare. Strained health facilities due to rural nuances such as provider shortages place an already vulnerable state at higher risk for negative patient outcomes. According to a 2021 report, Wyoming ranked number 1 in the United States with an overall 26.3% death by suicide rate, nearly doubling the U.S. rate, and has continued to remain in the top 3 through 2024. Rural risk factors for health disparities include geographic isolation, lower socioeconomic status, higher rates of health risk behaviors, limited access to healthcare specialists and subspecialists, and limited job opportunities. Rural residents are also likely to have employer-provided insurance coverage. Most of these families fall just above the poverty line, do not qualify for Medicaid, and cannot afford private insurance covered under the Affordable Care Act. Patients impacted by these disparities in rural states are more likely to depend on services available under Wyoming's Medicaid program, which provides medical insurance to groups of low-income people and individuals with disparities. According to the Kaiser Foundation, as of 2025, 71,000 residents depend on Medicaid to include vital behavioral health services covered under the program. The history of Wyoming and Medicaid expansion has made little to no changes over the years. As a historically red state with conservative values, Wyoming leaders have seldom pushed forward proposed policies for government-funded health care in any form. In 2010, under the Affordable Care Act, the proposal to expand Medicaid became an individual state matter. In 2014, the expansion went into a nationwide effect, with Wyoming legislators opposing its implementation. In between, state legislators debated whether or not to expand. In 2021, House Bill 162, the Medical Treatment Opportunity Act, was proposed for Wyoming's Medicaid expansion. The bill passed the chamber, but was voted against on the Senate floor. For years to follow, state legislators would argue whether the state would benefit from the expansion of such programs. In 2023, an amendment to the state's supplemental budget to include Medicaid expansion failed again in the Senate. The years to follow have sparked much debate, and Republican lawmakers still voice their reluctance to favor an expansion. As we've learned over the past several weeks, behavioral health in Wyoming, a rural state, has been a focal point for the state's legislators. The Why We Care initiative, implemented by Governor Mark Gordon, is a behavioral health reform initiative geared towards improving care under 5 pillars: access, affordability, quality, innovation, and cultural shifts. As a safety net, Wyoming has established behavioral health center benefit plans. These centers offer outpatient and residential mental health and substance use disorder treatment services to underserved populations. The behavioral health clinics offer specialized services that would have otherwise overwhelmed primary care physicians across the state. Beyond this initiative, Wyoming has the potential to further expand to behavioral health services through the proposed Medicaid expansion policy. Why might you ask that expanding Medicaid is the best choice? A 2023 report ranked Wyoming among the top in uninsured. First, expanding Medicaid would close this coverage gap. Currently, the program does not cover childless adults unless they are disabled or meet other strict requirements. Under the expansion and new rules, almost all low-income adults under the age of 65 with income up to 138% of the federal poverty level would qualify. Second, a lack of coverage further hinders rural hospitals' ability to provide care due to the burden of uncompensated care. The Wyoming Hospital Association estimates that the state loses $120 million annually treating uninsured patients who cannot afford to pay. Under the expansion, rural hospitals would be protected and facilities would see an increase in Medicaid revenue and overall operating margins due to increased insurance coverage. This leads me to my third reason to expand Medicaid. Wyoming's financial benefits of expanding are substantial. The traditional federal match rates range between 50 to 77%. The expansion will match the federal reimbursement 90%. Additionally, incentives under the 2021 American Rescue Plan Act will provide a temporary 8-quarter 5% point increase in the federal Medicaid assistance percentage for the state's traditional Medicaid clients, estimating gross incentives to be worth $54 million over 2 years. And now the selling point. Wyoming has one of the highest suicide rates in the nation and significant rural behavioral health shortages. Expanding Medicaid would bring steady insurance coverage for patients needing therapy, psychiatric medications, or substance use treatment. Access to preventative care is crucial to preventing further crisis and/or hospitalizations. According to the Wyoming Department of Health, because of the financial incentives, the expansion has been proven to increase the number of behavioral health providers who accept Medicaid, expanding the vital network of available care. Medicaid covers outpatient therapy, medical management, substance use disorder treatment, early periodic screening for children, and telehealth options for those who qualify. With the expansion, the state anticipates increased utilization and improved mental health outcomes among newly insured adults. More access would increase utilization and provider acceptance, improving mental health outcomes across the state. In conclusion, health policy implementation should be thoroughly evaluated to project the best outcomes for our clinicians and those we serve. Understanding each stakeholder's role spanning this process is vital to its success. Under the Medicaid expansion, the research proves that this option closes coverage gaps, decreases the financial burden placed on the state and rural hospitals, and most importantly, improves mental health access needed to serve Wyoming's underserved populations. This expansion is proven to be both a fiscal and moral opportunity that has the ability to strengthen communities and health outcomes across the state.